Okay. Oh boy.
And
Yeah.
all that. And
All
it just
right.
kind of gets worse as I do it. And it goes all down to the ribs and things like that.
Good, let it go.
That one made it tight really there. Ooh. Stinger. All right, we're good though.
All right, yeah, we got too much motion in the lower neck there. Your lower neck is so eager to move. You want your upper neck to do it. His lower neck is so loose that it moved in concert with his upper neck. He didn't move independently. What happens is your upper neck should move there, but it moved in conjunction with your lower neck. I tried to have just your upper neck move, but your lower neck is like that eager student in the front row that wants to answer all the questions. I have to like put him in timeout. There you go. Okay.
In high school, when I would wrestle and I'd do like neck movements and stuff, it would happen a lot.
Oh, that was nice.
Well, I'm 27. I'm from Lakeland. I have been having back problems since freshman year of high school.
Okay.
I was a wrestler, and all of a sudden I started noticing issues with just lower left back, sharp knife-like stabbing pain to the point where I couldn't even walk without grunting. I'd be sitting in class and I'd adjust. And turns out I had an extra bone.
Okay.
Two of my lower lumbars never fused into a bigger one from what I could see.
Okay.
And actually, from what they told me, I had an extra joint attached to my left hip with that.
Okay.
And it caused a weakness. And so I have a sixth lumbar.
Okay.
From there, my junior year of high school, I got a herniated disc in my right cervical side. So my arm went numb most of the time, things like that. So a lot of overcompensating came from there. And then I tore my ACL when I was a sophomore in college.
Okay.
Got that fixed 3 or 4 years later.
Any MRIs of your lower back?
No MRIs of the lower back.
I'm just curious. When I looked at your X-rays, I mean, it's very possible there could be a sixth vertebrae. What's difficult, if you want to come over here, Carl, I would consider that to be lumbar 5. Looks like a normal lumbar 5.
Yeah.
4, 3, 2, 1. That'd be T12. So, what my first suspicion, and it could be, like I said, you could have 6 lumbar vertebrae. My first suspicion is you just didn't get ribs on T12. Would be my first. I don't think you have an extra vertebrae. It could be. Again, I want an MRI.
I took these when I actually got my X-ray certification a few years ago, but the X-rays they saw the extra bone on was when I was a freshman.
Because I don't see lumbarization of S1, which is generally what you'll see on your lateral here. Here's your lateral.
Yeah, I don't see it here either.
That's a normal sacrum there. And we got L5. Now, what's happened is on your A to P, we have tilting, right? So when you look down the slit of, this is why I'm not a big fan of X-ray. So if I'm looking straight down this slit, you can see the disc, right? But if I tilt it, all of a sudden the disc cannot look as thick.
Yeah, they look more stacked.
Because there's either tilting or rotation, usually tilting.
Yeah.
So on your A to P shot, is A to P, anterior to posterior, on his front to back shot, we got tilting, right? Look at your wing of, now this is your right side over here, so you're on your right, now your right hip is higher, so again, that's your body's trying to relieve pressure on the left by raising the right hip, by raising your right hip, but my point is on your A to P we have tilting, so on your lateral, the disc space isn't going to look normal. I mean, yes, if I just saw that and I didn't know there was tilting, I'd say you have definitely minimal, the disc there at L5 is much thinner. So you have, again, I want MRI. I want to see where the disc is. I want to see if there's desiccation of the disc. It doesn't necessarily affect my treatment. It does affect how serious I am with your care. And look, we're late. You're 27, and your lower back is older than you are. It does look like it's definitely under stress because, and you can see the hips there on the overlay. There's
they're
one
definitely
hip,
off.
and there's one other. So again, we got.
And I feel that day to day, even just sitting here.
See, that's Antalgia, right? So if I raise my right hip, the holes on the left side get larger to alleviate sciatica on the left. Oh, doc, I don't have sciatica on the left. Correct, because your right hip's gone up.
Compensating.
Until it no longer can.
Yeah.
Until the disc bulges get large enough that even with the compensation, it's not enough.
Yeah.
And then this gets really silly really quick. The right hip's high. Chiropractor, oh, that's bad.
Yep.
And then we hit the nerve again.
Yep.
Or right hip's high, your right leg is short. Let's put a heel lift.
Yep.
No, let's get the stress off your lower back so that there's no longer a need for that hip to happen. If you hold a hot potato, of course you're going to be shifting it around. Stop shifting around. Well, I'm in pain. I have a symptom. I have an injury. So once the potato isn't hot, you won't need to be maneuvering it around. For the purpose of guarding our organs, we're supposed to have 12 ribs on each side.
Right.
And that rib cage protects our organs, but kind of the drawback of it is that this area biomechanically becomes stiffer quicker than your lower back. So he's got facet pain, you said left lower?
Well, that's been gone since high school. I've learned to manage that, but it's just caused that general imbalance in my body. Like you said, I don't feel that pain anymore, more than I do feel just the general tightness on the right side.
Right. So, but the facet pain was on the left.
Yes, the initial pain was on the left.
So by lifting the joint here gets mainly, we would say you have pain when it's compressed.
Yeah.
Do you understand?
Yeah.
So to alleviate facet pain, your body raises the right hip. Yep. So the facets here on the if you can see here on the model are these little handshakes here. So I'm going to use this guy just for easier to see. They look like a handshake where two surfaces slide over. That joint capsule is loaded with pain fibers. And so if you compress, so your body learned to just tilt away from it. We call this Antalgia. The body did that by raising the right hip.
Yep.
Opens up the facets on the left, and that's an avoidance. Now what will happen is, because the right hip's higher, now we're compressing the discs on the right, which then can cause the disc to shift to the left. We don't want to, again, it's balancing, like juggling things. My main purpose is twofold. One, remove all the stress off your lower back, try to get your middle back in the game, and then aim your spine back to that curve position. If we had the curve in our spine, the weight of our spine is going to be more evenly distributed, and not all the stress is going to be in one spot.
I'm an X-ray tech.
Okay, very good.
I love X-rays. Sorry.
I only did it for the pay raise. I was originally an MA, and that was they had a need. I picked up the textbook, studied it, took the test, and now I get paid to take X-rays.
It's great. I just.
He just doesn't like them for discs.
It is the very bare minimum when it comes to imaging, and it doesn't always do the greatest. I know that. It's either the patients or the machine or the tech doesn't always get the greatest images.
I'm just saying I saw farther down. Your sacrum looks normal, so you don't have like even there's your S1 disc. I don't think you have. There's not lumbarization of S1.
Right.
So either you have an extra vertebrae. Usually what we have is sacralization of L5, right? So you have 4 lumbar vertebrae because your lumbar 5 is fused with your sacrum, or you have S1 becoming L6 essentially because it didn't fuse with S2, right? So you have this extra vertebrae. It's not it just didn't connect. Not a folic acid, whatever. The joints didn't completely. The sacrum didn't completely fuse with itself. If I was a betting man, I'm going to bet that you just didn't get ribs at T12.
It's very possible.
That's what I would be my gander. Even your T11 ribs look really short. You understand? So even the ones T11, he cuts off. That's a really short rib there at 11.
Yeah.
So the floating last 10 ribs connect to the front, 2 dull, 11 and 12, and they're much shorter. The left knee. Give me that story again.
I was at a wall-to-wall trampoline place, spring break, freshman year of college. Jumped, and my knee just felt like somebody clipped it with one of the balls. I looked around, no one threw anything at me. My knee gave out. So it was swollen. The next day I was walking fine. 3 years would go by. I'd either I'd pivot really hard, or I'd go back to my old wrestling team and practice with them, and my knee would give out. And then all of a sudden would swell. And then I got the MRI, and they said, you have an ACL. It's just disintegrated, and you need it replaced.
Okay, so is there any current pain in your left knee?
It clicks a lot, and no, it doesn't have any current pain.
Do you feel it sliding? Like
I can adjust it and move it and do all sorts of crazy crap with it.
And they explained to you that the ACL's job is to prevent that motion, and then
it's that cross.
So the tibia can slide forward on the femur, and I'm imagining if I pull real hard, that puts a shearing force on the meniscus. The meniscus, like the discs in your spine, handle compressive forces very well. They don't like sliding forces. That ages them at a faster rate. Is the pain inside here?
Yeah, it's usually right where your 2 fingers are is where I feel most of all the
so the
fluid.
What surgery did they do on that?
We did the cadaver.
Try to repair that ACL?
Yeah.
And what's I think it's
about 25% of my meniscus as well, I think, too.
Okay. The main way I'm going to try to treat that is by stretching the quad. That'll allow this to open up and try to hydrate the meniscus as best we can. Most things in life don't require a lot of range of motion in the knee, and so there isn't very much blood flow to the knee anyway. When you do arthroscopy, there's not much in there, and so you have to bend the knee and move it to pump blood and rehydrate that meniscus. With that, ACL injury, that is going to place a little bit of accelerated aging on that meniscus.
Yeah.
So you said you have shoulder here. Describe that for
I
me.
think it was cervical, and then it goes from here, and then it goes all the way up till about right here.
Okay.
And then it comes down and then kind of locks in my subscap. And
Okay.
all that area is just always clicking, rubbing, popping.
Slowly let your head go back. Slowly, slowly, slowly. There you go. See, the first fold is there. That's where it's, keep going, keep going. There's a little bit up here, but most of the folding is right in the lower neck.
Yeah,
and
I can feel it.
So that's right in there. Biomechanically, your upper neck should be doing 60% of the work of your neck. When we're bending, the atlas is designed to do most of the flexion and extension. There shouldn't be very much flexion and extension happening at C5, 6, and 7, which is also where all the surgery happens that nobody talks about. This model does a pretty good job of showing how loose, even in rotation and lateral bending, that the atlas, occipital, atlantoaxial joints should be. There's no discs up here. There's nothing to wear out up here. The first disc is at C2. So we want to restore as much motion to your upper neck, and that will take the burden off your lower neck. The curve in your neck locks these joints together. You actually can't rotate. So the top of that spinous actually locks.
Yeah.
And so you can't overstress your lower neck when there's a curve in your neck. You have to first fan the spinuses to allow the lower neck to be overstressed. We want to bring your head back, not by using your lower neck to do it. Otherwise, we're going to pinch that nerve. It's going to cause pain down your arm. We want your upper neck to do it. That's why we're not going to do much stretching until we're satisfied that we got your upper neck fluid and supple enough. This is why we can't you just give me the stretch head and get me out of here? Well, we got to prep you. We have to make sure your whole spine's working so that we can safely stretch. This is how people can get in trouble sometimes with stretching exercises or yoga. You know, I tried yoga and it hurt me. It's like, well, when you did standing bow pose, you weren't bending evenly. Parts of your back were hyperextended, parts weren't moving at all. So the chiropractic part is as a way to quickly unlock parts that are stiff, and then so your spine is bending evenly. Okay.
Just kind of tiny pop there.
A little bit.
Okay. Oh boy.
All that. And just kind of gets worse as I do it. And it goes all down to the ribs and things like that.
All right, we're going to check all that in a second.
Thanks.
Maybe cross this arm over for me. All right, take a deep breath in for me. Lil, help me sit up. Sit up. Deep breath, and then head back. Let all the air out. Exhale. Keep going, keep going, keep going. Very nice. Deep breath in. Head back. Exhale. Deep breath in. Chin down. Exhale. Let all the air out. Yeah, real tight there. Oh boy. We got work to do. On your side facing me. All right, deep breath in for me. Exhale. There you go. Breathe and then relax. Let's go outside for me. There's a difference between being adjusted, does that make sense, here, being adjusted here and up here. We're trying to not manipulate the areas that are typically injured and move as much stress away. Exhale. Okay, good. Let's go face up for me, face up. Everything's over the right. I'm going to go gentle. I'm just going to side. Good, let it go.
That one made it tight really there. Ooh. Stinger. All right, we're good though.
All right, yeah, we got too much motion in the lower neck there. Your lower neck is so eager to move. We want your upper neck to do it. Here we go, I got you. A little bit deeper, come on. There you go, okay. Here we go. His lower neck is so loose that it moved in concert with his upper neck. He didn't move independently. What happens is your upper neck should move there, but it moved in conjunction with your lower neck. I tried to have just your upper neck move, but your lower neck is like that eager student in the front row that wants to answer all the questions. I have to put him in timeout. So he's got to go easier. You got to go easier on this upper neck. This has to be And then as your care progresses, this will move more independently, and then you won't have that happen. That's happening because your lower neck is, first of all, it's inflamed. We have a disc injury, it's upset, and then any level of it being blown on gets it upset.
Mm-hmm.
And then the subscapula, all the shoulder is controlled by the C5 nerve in your lower neck, and so that's where all the bending's happening. And so it's not a coincidence that your C5 disc is probably in trouble and the shoulder's having issues. Those are all in the same circuit.
Yeah. Every time I turn my head to the left, it feels like it pulls it all up.
Yeah.
It just like locks in.
Gotcha. Yeah, this is all tangled up here. There we go. A little graininess over here too. Just shouldn't be any. That.
Yep, I can
think of how to train. I think of How to Train Your Dragon. You need to stop all this.
That thing.
You just gestured to all of me. Yes, stop being all of you. Oh, you, sir, are playing a dangerous game. As much. We just gotta sort of lock you in this position. So there's a piece of foam called a Denerol, and it is a retainer that we use aftercare to keep your spine in the right alignment and maintain that, and then over time your body will more and more want to be here. So posture isn't something that you can just like put more curve in your neck. It's not consciously your fault for not having curve in your neck. It's something that's stretched out of your neck and has to be stretched back into your neck. Alignment is easier to change when you're younger, and then the cement hardens and then it's not impossible, but it's harder. It's not as receptive to change.
Uphill battle.
Was it teaching old dogs new tricks? It's just the same kind of thing with your posture. Your body has habits and patterns of movement. The longer you've been smoking, the harder it is to quit. These are
ingrained in the routine.
Yeah. Tried that, but
Yeah, I can just feel the roll.
Yeah, it's an old injury. It's a tear. Like the initial tissue was organized, and then it tore and it healed with a callus. Does that make sense? With a keloid, like a scar. So that's what's locked up your upper neck, is when you were younger, when this was the loosest part of your neck, it received the injury. So when we're whiplash, we only get injured in the parts that move. The parts that don't move don't get injured. And so when we're young and our upper neck is loose, that's where the injury, does that make sense, gets put into. So almost everybody has their oldest injuries in their upper neck. That area then stiffened up. The head went forward to avoid. That unlocked the lower neck. Now the lower neck has spent the last 10, 15 years under extra stress. Now it's finally had enough, and there's domino effects that have happened. Right there's some gristle.
That's where it hurts the most.
I don't like it. I got a magnet in my knuckles.
That
goes
goes-
right to the spot that I don't like the most.
Yeah. And it goes all the way down to like my thumb and my forefinger.
Is that just because there's pressure on the nerves or inflammation that it travels?
Well, the nerve is upset, so the deltoid is C5, and what you'll have is you actually have an atrophying of the tissue because the nerve is upset. And so you'll have tears and weakness and injury, mainly because it's not getting its upkeep. It's not getting its UPS shipments to regenerate. And so it's like, is it really being injured, or maybe it's just not being maintained? Does that make sense?
There's a pathway cut off to it somewhere.
Right. I mean, that's why I asked if you kept doing wrestling, because, okay, the traumas have stopped, but the area really isn't, getting better, which then leads credence to C5. It's really the disc that's being upset. And so people will get lost. I call it chasing the carrot in here, trying to fix the shoulder, but until the nerve is alleviated, it sometimes can be very difficult to get this to be where you want it to be.
Right.
And so I find that if we get the neck healthy, then this all just sort of, fixes itself.
That's the goal.
Yeah.
That's the dream.
I guess he's funny.
Or it's a cat being attacked. Moving this around also moves this around. Your body's trying to alleviate nerve pressure along with dysfunction in the shoulder. You know, your body's, like I said, I'm going back to the hot potato analogy. This is the thoracic outlet here, the channel that the nerves travel down into your arm through.
That feels amazing.
So you have a lot of
That's really purple.
That feels amazing.
a lot of inflammation just in this corridor. To me, the first step of treating this is getting rid of all this soreness.
Yes.
And then when it's no longer sore, you won't need to fidget.
Yes.
It's now, a lot of the reason why this is inflamed is because of the alignment of the neck and shoulder, loss of curve in the neck. So it's a domino effect where ultimately your upper neck has to be unlocked, the curve restored, and then the stress in the upper back will be alleviated. Because really, relatively, I mean, there is some in your shoulder, but relatively, there's a lot more in your back than there is in the shoulder. I didn't really gua sha this very much, and it came out real dark. I gua sha the heck out of this. There's some, but it's not as much as if you had a lot of, you know, there's a lot of damage to your labrum or your glenohumeral joint or tendonitis. This would come out real bad. So it's right above. See where it moves. It actually will be clean because it moves there. Do you understand?
Yeah.
It's the areas that are clogged around that you'll find the most mark in. Right. Just adjusting, you will never get the curve. They tried for 102 years. Chiropractors thought that we could push the curve back into people's spines, and it's not possible.
The
It's
muscle pulls it right back out.
well, just ligaments. The ligaments, a tight ligament in the front. So the anterior longitudinal ligament runs from your front part of your frame magnum down to your pubic bone. And because we're always bent forward, that ligament's so tight. So even if you strengthen your back muscles to pull you upright, that ligament will just out fatigue the posterior muscles. That's my point. That's all crud.
Yeah. That's where I feel it all up in here, and then it pins in here. It's like I'm locked like this all the time.
Check subscapularis a little bit. You want to, I know. Oh, that's fun, Ed. You know, my sister did this to me, and I was like, "Oh, Brenda, this felt like Princess Bride." Where, and remember, it's for posterity. It's for posterity. What is that?
It's a great movie.
Yeah.
Oh, that hurts.
I know. Right. But again, this is really from the lower neck. But sometimes you do have to push on these areas to get them to release. There we go. What I'm seeing here is left middle block here, was going to cause right abuse. You're in left avoidance because of either healing in compensation to your left lower, you know, from high school when this was injured. Now you've healed, tilted to the right, avoiding this. So this is all jammed up on his left middle, and now the right lower is gonna, it used to be on my left head, now it's on my right. This is how things can shift because of compensation. But this right here is tighter right there. That is not as prevalent on the right. There we go. It's going to be pretty boring, just me unlocking this. You have to get the stress off of this. Or back onto this, but stress off the lower back. I know, yeah. Like when I adjusted you earlier, I wouldn't give most of this even a pass rating. Thanks, Ed. You know, I'm going to get it moving better after we release some of it. It shouldn't require, you know, Ed, I adjust better if you spend 20 minutes massaging me. The answer is it shouldn't require a 20-minute massage to get your bones to move.
Right.
Now, I'm going to do that initially to unlock them. You shouldn't have to keep putting PB Blaster and WD-40 on a bolt to get it to turn. It should just turn. You understand?
Right.
Now, if it's frozen, there are certain things you have to do to unlock the bolt, but that shouldn't have to be the norm.
Right. You just need
The
to
bolts
maintain.
should just be turning. The oil filter should be hand tightened, and if you put oil on rubber seal, you'll be able to unlock it or unloosen it easily. Don't ask me why. I know that maybe I forgot to put oil one time on my oil filter. Anyway.
You live and learn.
6 hours. Please come off. Anyway. There we go. There we go. But it's right there. Yeah.
Yeah.
That's what might be perceptible is that, Ed, I think it's getting bigger. What's going to happen is your care progresses, everything else gets smaller, and all we're going to be left with is this. Do you understand? It's not getting bigger. Everything else is
Just getting smaller.
getting smaller, and then this is not going to change as quickly. And so it might appear that it's more apparent and larger, but it's not. I'm showcasing it. I'm going to keep shining a flashlight on it, but that is your injury. See how this is smoother? Doesn't have that
Bump. Massive speed bump.
Massive speed bump on my highway. Who put that up? Speed bump there.
That would be me.
There we go. Okay. There we go. Breathe, yep. Behind your back for me. This is the area, that third adjustment I did when you were on your back. This area pretty much stuck its tongue at me.
Yeah.
It said, yeah, buddy, I don't move in here. And that is why your lower neck is in distress.
Yep.
This area is responsible for assisting your lower neck, and it's already quit.
Pretty bright
Yeah.
already.
Sorry. Stop, Ed! You're killing me. Right, I know. It probably didn't feel like anything.
Nope.
Right. That's how much is built up in here. Connect my drawing here.
I'm gonna make a giant S.
Okay, connect this to right there. We go. Ta-da!
Do that again.
Ta-da! It's gone. I'm stealing from Joker. I'm I'm gonna make this pencil disappear.
Ta-da!
Ta-da! It's gone.
Where'd it go?
I like the one criminal's like, huh? He's like, he did make it disappear.
What? No, it's just in his head. That's lame. I'm a movie buff.
Ooh, yes. You wouldn't by chance have 6 fingers in your right hand. Do you always begin conversation this way? My father was slaughtered by 6 fingers.
My name is Indocumento.
That's right.
You killed my father.
That's right.
Prepare to die.
Uh-huh.
I was told I look like the Dread Private Roberts when I grow my facial hair out.
Yes,
There you go.
Well,
Good.
you know, you do have that look.
We'll carry Ellen.
I'll take it.
Some collisions in here. This is wrestling injuries. Rib, torque.
Care was not the thing I did to my body. It was a lot of beating up of it when I was younger.
I gotcha. It's doing better. It's not nearly as speed bumpy.
Good.
Feel the difference? It's not.
I can.
It's not nearly as.
I can feel a difference.
Oh, much better, much smoother. Wow. This is nice being about being 27. Is that you understand? If this was 57,
Yeah.
you wouldn't see a huge change like this. Sorry, everybody, but 27. Wow, it's like a different back than when I started. It really smoothed out.
I can tell. It feels a lot different.
Yeah, that's really smoothed out there. There we go. Mm-hmm. You okay?
Mhm.
There we go. There it is. Good. Oh yeah. There it is. Good. Good. Oh, good. Greedy chiropractor Dr. had it. He's so greedy. We gotta get you better and better up here. Try to relax your back as best you can. Try to. There you go. There we go. Just trying to. There we go. Work on you in extension a little bit. Almost like a cobra pose. You know, you're arching back. There you go. There you go. Good. Good. All right, let's try. Relax your back. I got you, bud. Here we go. Keep your forehead to forearms. There we go. Good. Breathe. Exhale. Good. Wow. You all right?
Mm-hmm.
You did great. Uh-huh. Good. Okay. Very good. Put your arms down. There we go. All right. You all right?
Mm-hmm.
Oh, that was nice. See what we did? We actually brought you into extension and then adjusted you. Gets a deeper adjustment into these joints, loosening these. And now we're going to stretch. You can come up for me. Right.
Wow.
Yeah, it's a lot. It's hard to see the color.
You can
This
see
is-
the rolls
It's
of
like
it too.
it's like dark. It's all old. These are old injuries. You got to get all that. This is the epicenter right there.
Yeah.
You got to get all that out of there. So generally, the tibia checks anterior movement. The ACL checks anterior movement of the tibia on the femur. So if I pulled real hard, I imagine it would not be good. So let's not do that. But we want to stretch this quad out. The tighter the quad is, the more the meniscus is held in a vice grip. That shearing force that's on the meniscus is going to age it at a faster rate. So as much blood flow and hydration and nutrition we can pump into the knee is going to slow down the aging. So we know we have an ACL injury. We know there's some instability in the knee. We don't want to have any lingering. So if you look at your quad here, can you see this? Right?
Yeah.
That's inflammation in the quad, which is keeping it contracted. So you need oxygen to contract the muscle. You also need oxygen to relax the muscle. So sometimes if there's areas that are tight, won't unglue themselves, unbind themselves without somebody pushing blood in here to release it. But this is causing some level of accelerated aging on the meniscus, along with, I understand, ACL tear. But I would, what can be worked on, what percentages are fixable. We want to try to keep as clean as possible. Left knee on top of the table like this, and then try to come down and sit. Breathe. A little painful?
No, just not mobile.
All right, try.
Am I supposed to further?
Yeah, yep.
Okay.
There you go.
There we go. I just
There
heard
you
a
go.
couple pops.
Good. Want you working on that. Try to get that butt to your heel. There you go, good. The second step is you put your foot, so follow me, go like this. So turn a little bit, there you go. Now the toes pointed. Now gently, try to come down inside of the heel. Breathe. Yep, come down inside. Ooh, I know, you need to work on this. Got the knee pretty well stretched out. Yeah. Okay, good. Good, here we go, good. Ooh. Oh, I just missed the other, daggone. Got these toes. I spoke too soon. They're just silent. There it is, they're just quieter on this side. Good. Tilt your head to the left for me. Tilt left. Real good. Tilt your head left for me. There we go. Good. Okay, not too much. Okay. All right, go ahead and tilt your head to the right. Well, okay, no. Already moved. Tilt your head to the right. Okay, good. Nice and loose.
Actually, even just tilting my head to the right is easier now than when I first got in here, just
Yeah.
doing that properly. Because
How's the looking
before
at-
I'd do this, and this all would like suck in here, and just then I could actually keep this pinned down and actually tilt my head over.
Yeah, we gotta. So let your head move back. Let your head look up for the ceiling for me a little bit. Yeah, we got a little bit. Now we got a little fold now in the upper neck now starting. Gotta get that creasing, but your neck is now not. So you let your head go back slowly. Yeah, right there he starts to crease now in his upper neck, and it's not just all creasing in your lower neck. Let me have you come on over here. There we go. Perfect. This is the curve that your neck needs to be in. Leg straight for me if you can. There you go. Good. Sometimes I take my hand and just place it on my forehead and press, try to get your head to go into the mold. Does that make sense?
Mhm.
And then you put your hand back down on your belly or by the side. And the goal is 20 minutes. You're trying to mold and retain the arch in your neck. Now, when the neck is stiff, this device is not as effective as when your neck is, loose. Now, I think your neck is loose enough to even start molding, so I think you're ready to go. But some people need more time in their upper neck. Your whole neck is really loose, and your lower neck is very loose. So if you feel anything in your lower neck or down the arms happening, we got to stop. Everything I do on the table is all prep work. It's all time to make the spine like clay, soft and supple, and not so inflamed, so that the stretching is effective. And then gently bring your knees to the right, stretching. We're trying to open up that anterior part of the disc. So the only reason the disc is posterior or bulges posteriorly, you understand, is because there's so much anterior discal pressure. And so as we arch back, we relieve the anterior discal pressure, which then moves the disc towards the center where it's supposed to be. Does that make sense?
Yeah.
The only way, we call it a vacuum effect in terms of the disc. It's almost like a straw gets sucked back to where it's supposed to be. The disc actually doesn't want to be so posterior where the nerves are in the spinal cord. It wants to be more towards the front. But because there's so much anterior discal pressure, it shifted it. And that requires getting the curve back, arching your body back, stretching the front, and bring your knees back up. Good. And now move 1 inch down, so try to roll upwards. I know, yeah. You okay?
Mm-hmm.
Yep. And you just inch by inch, minute by minute, you're moving down. Eventually, the goal is to have this roller right over that place that I was digging on. You want to, and then you're moving less. So at the beginning, you're moving every minute 1 inch, and then as you progress, you might spend 5 minutes in one spot. Does that make sense? And then eventually, your whole 20 minutes, just one spot. As we stretch more, your body's going to become more upright, which puts weight on those joints that you've been avoiding. So we just need to, don't be disheartened. Ed, I'm feeling more stuff in my back. What the heck, Ed? I told you, your body's been forward, and it takes time for your spine to get acclimated to being upright. It's like you're moving teeth. The teeth are moving, and now your bite's changing, and it's going to feel, a little disconcerting and a little awkward. We're bringing you back to where you were when you were younger.
And because it's supposed to be there.
It's supposed to be there.
Right,
we're not creating anything new, and we're not trying to put you in a foreign position. It's really where your back used to be when you were a year old, and life took us away from that position.
Darn trauma.
Right, injuries, trauma, and then mainly
It always
sitting.
comes back to trauma.
Well, when you have an injury, your body shifts the posture, right? So let's do a classic example here is a car accident. Okay, so say your posture's here, right? You follow me? You have a whiplash, right? You get injured. The joints now the disc and the joint get injured, but you only feel the joint. The disc doesn't have any feeling. So the back side of the spine has the injury. Your head then goes, oh, there we go. It's all better.
Yeah, and I don't feel it anymore.
I don't feel it anymore. We take the weight off the joint. We put it more on the disc, but the disc doesn't have any feeling. And now what happens is we heal in avoidance. You're now healing and hardening in the wrong posture. That's what then causes what we call compensatory injury. So you have the injury of the car accident, right? The tear, and then the avoidance, and now the avoidance actually creates more disc injury because the posture shifted. And I would actually attribute, I made up numbers, 80% of an injury to the avoidance, not even to the initial injury.
I would agree.
Most of the injury is the posture change, and then the effects of that posture change. If I see this all the time with people that have injuries and they come in and get care right away, we stop the avoidance and process the original injury, and it's almost like it doesn't exist. It's very easy. So if you have a car accident, you get an injury, don't wait 6 months for treatment. Get in as soon as possible so that you don't heal in avoidance.
Told one time it's good to treat your muscles and nerves like a stick of gum. If you try and pull a stick of gum apart without chewing it first, it just breaks in half.
Just breaks in half.
But if you chew it first, you get a warm, get it active, you can get
Warm up.
stretching, and it's more mobile, it's more malleable.
Yeah.
That's a good
Yeah.
analogy.
Yeah.
I'm gonna have to use that, Ed. You're gonna hear it in later videos.
The
like,
day.
"Hey, that was
Team.
funny."
Yeah. I don't want to pull forward as much
Right.
as I did before.
You want to keep the rest of your life working your way back on your heels.
Thank you.
All right, brother. Thank you, sir. Awesome.